Doc Talk for the waning time in September. A lot going on in the area of COVID right now as the weather changes. And it's a really gray day where I am now. Fall will clearly be here overnight tonight, as it has been sweeping through much of the country this time of the year. That means two things. Cooler temperatures and a little less worry about heat exertion and other heat-related illnesses. Number two, allergies are not far behind. A lot of my crew members, well vaccinated, but sneezing and their eyes watering. Many of them have done their own COVID tests just to make sure, and that there's nothing wrong with that strategy, but it's allergy time of the year, both for us and for our patients. So be aware of that as you're taking care of yourself and as you're taking care of our population, and as asthma and other things begin to climb in incidence. This is the time of the year when we still have to provide great care for people who have their usual seasonal issues, and we should not be fearful of them having coronavirus infection if in fact their wheezing is due to allergy and other seasonal problems. This week has been an important week related to vaccinations. The most important news of the week is Pfizer has submitted and the FDA is now considering approval of an emergency use authorization for those down to age 5. So that would get us into our grade school aged kids. Why is COVID vaccination important for younger children? Well, just like they receive as part of their primary immunization series in this country, vaccines against polio, against measles and mumps and rubella and tetanus and hepatitis and other very preventable diseases. We need them to get coronavirus infection protection, and that will come from a safe vaccine, both safe and effective. Those are the two elements really important to you as a parent or a grandparent for your children. We also, by protecting the children, will reduce the incidence of adult infections, as those children are kind of known as incubators for infections. And variants come more frequently out of the pediatric population than out of the adult population. Their young immune systems learn by being exposed to various respiratory viruses how to deal with them effectively and not cause them significant problems that end they have the rest of their life. And in some cases, their viral loads are higher in order to get to that protection for themselves. That makes them a little bit more of a virus factory related to adults, and why we should protect them and do protect them with primary immunizations. You should all know worldwide that they're doing research to get to eventually an oral or a nasal form of a coronavirus vaccine, but we don't have it yet. We anticipate that within the next 3 to 4 weeks, so let's say mid to later October, that there will be vaccinations available for school-aged children. Very important development for all of us. As we do more and more vaccination programs, we're now looking at the advantages and disadvantages of additional vaccines for adults and other populations. What is the science saying right now? Right now, the science is saying for people who are over a certain age, whether it's 60 or 65, that there's an advantage to them getting that additional vaccine. For people who have immune problems, there is a significant advantage to getting an additional vaccine. For the rest of the population, not really sure. Therefore, the FDA's committee looking at additional vaccines for the adult population that is not immunocompromised have not approved that program yet. I know very well that some of you are going to go and get that third vaccine now in the series because you want that extra boost of protection. And if you've discussed that with your primary care physician and don't have other reasons not to, I understand why you would want that. For those of you who have compromised people around you and you do not want to take any chances of being infected. That would be very important for you to discuss that with your primary doctor and consider getting a boost vaccine. What other things are going on important to us now? Well, let's go back to our basics. And as laid out by the IAFF, there's some really important things, particularly as we move into cold weather season, that we do to protect each other and protect ourselves, and then to our families. Number one, where possible, wear a mask in the common areas around the stations, in closed vehicles, in situations where you're around other people, like this time of the year, we're out teaching in the schools. We have to go out and get groceries and do the other things that are part of our duty life, as well as our personal lives. Social distance where possible. That 6-foot radius is still a really good one. Number three, in patient care situations, make sure you're using universal precautions. And we are back at the point in most areas of the country where we should be sending a scout person in and only exposing the minimal number of people to do excellent patient care or interaction with the public at an emergency scene without exposing an entire crew. That's really important that we protect ourselves in all circumstances then when we're around the public. Around the station, washing your hands and using other personal hygiene techniques that keep you away from respiratory infections. And very importantly, as always, don't come to work sick. And that can be important. Again, going back to the original discussion, this time of the year, many of you will have seasonal allergies. Get those under control. Talk to your doctor about medicines that can be used. Do things around the house or around your personal life that protect you from exposure to allergens where possible. Take some control medications. If you have any concern about being infectious, then you need to check with somebody, primary care, urgent care, occupational health, to make sure that you're not ill and bringing illness into the station. That's really important. We have kind of proven so far in this coronavirus pandemic that doing a lot of surface cleaning is not beneficial in protecting against coronavirus. In our environment, it is really important to do a lot of surface cleaning to protect us from other bad things, E. coli and Clostridium difficile and other things that hang around on the surfaces of our medical equipment and stretchers and other patient care devices, and then around the station in the common areas like the toilets, the kitchen, and the day rooms. Otherwise, don't think of doing a lot of surface cleaning and disinfection as a way to protect yourself from coronavirus. That has not proven to be a very good way for the coronavirus to be spread. Really, this disease is spread by coughing and sneezing, and by coughing and sneezing in an open hand and then touching somebody else. That's really the way that we spread respiratory viruses. Finally, I've got to say, a very somber time. This past weekend was the IAFF Memorial Ceremony. Honored at that ceremony was one of my friends who died of COVID last year. There are a lot more people being memorialized now, and there are a lot more deaths occurring right now in the service. That includes fire, EMS, law enforcement, and our 911 dispatch center personnel. We're at a higher wave of deaths within the service than we have been since the start of the pandemic. A very somber time when we're dealing with those deaths. Please take care of yourself. Please take care of your family. Please, if you haven't done it already, get vaccinated. That's the best protection. And then using those good skills around the station, the way that our moms taught us a long time ago. Please continue to be safe, enjoy the seasons as they change, and stay safe in the everyday operations. Thank you all. Talk to you next week. Doc Talk.